the facet, the orientation of the facet is quite interesting, especially in the neck, because it gives us a lot of clinical tricks, making it much easier to treat a patient. So, if I look at my patient is in front of me, and I am on the back, and I'm going to look at those facets. So the facets are going to be oriented around 65 degrees at the level of the upper cervical, C2, C3. We start at C2, C3, and they will be facing laterally, like that. Now, as I go down, they become more horizontal. So they are more vertical C2, C3, more horizontal C6, C7. That's important, because we will see the clinical importance later on. Then as they go down, the facet, instead to face lateral, they will start to face medial. So they will go facing lateral at the top and facing medial at the bottom. So those two elements give us some good clinical fact. First, if you have somebody sitting and you want to treat him seated, the doctor being behind the patient, you will need to have a more cephalad angulation to treat the upper cervical, C2, C3, than you will need to treat C5, C6. And finally, because it's oriented internal at the level of the base of the neck, you will not need the same rotation, very little rotation at the base of the neck, and more at the highest part of the neck to get that hard feeling during palpation, during positioning of the adjustment.